Mental Talk with Dr. Lola at NSD Mental Health Services. Today I will be talking about anxiety disorders, specifically generalized anxiety disorder. Generalized anxiety disorder is the most common type of anxiety disorder and is characterized by excessive and uncontrollable nervousness, unease, apprehension, and worry. The focus of the anxiety can vary. It can be a real or imagined health problem, family matters, career challenges, but the inability to control the anxiety is persistent. Individuals with generalized anxiety disorder often have somatic complaints like headache, chest tightness, and either a preoccupation with self-care or neglect of self-care. The diagnosis of generalized anxiety disorder is often obtained in a person with excessive and uncontrollable anxiety. To diagnose generalized anxiety disorder, the individuals who have 3 or more signs and symptoms, which can include muscle tension, fatigue, sleep disturbance, poor concentration, irritability, and restlessness for 4 or more days a week for 6 months or longer. Generalized anxiety disorder is recognized when these signs and symptoms cause clinical significant distress or impairments in the social, occupational, or other important areas of functioning and are not related to the use of a substance. So when the individual comes in, that's where the use of UA, urine drug analysis, come into play to rule out illicit drug and medication use. We assess for the presence of medical condition by obtaining lab work to rule out rule out any medical conditions like myocardial infarction, asthma, headache, anemia or caffeine intoxication, hypoglycemia, hypothyroidism, to name a few, or the presence of another mental disorder like panic attack, post-traumatic stress disorder, major depressive disorder, or other psychotic disorder. GAD often coexists with other psychological problems like depressive disorder and somatic disorders. This is why the assessment is very important. The etiology of GAD is unclear. The condition is likely the result of combination of biological abnormalities, decreased metabolic rate in the basal ganglia and white matter, abnormal serotonergic and non-adrenergic neurotransmission, and psychological factors, incorrect and inaccurate response to perceived danger, unresolved and unconscious conflict. The risk factors could be involves female sex, poor coping skills, family history of mood or anxiety disorder. Risk of the GAD is increased 6-fold in an individual who has a first-degree relative with the disorder. Increased life stressors, poor social support, low socioeconomic status, poor self-esteem, limited healthcare options, and being widowed, separated, or divorced also contribute to GAD. Persons with other mental health disorders and certain medical conditions are at higher risk for GAD. Patients with a traumatic brain injury are twice the risk of developing GAD than persons without the TBI. Again, the physical indicators to watch out for are changes in appetite, nausea, vomiting, trembling, sweaty palms, flushing of the skin, hyperventilation, muscle tension, headaches, rapid or irregular heart rate, dry mouth, dizziness, and agitation. The cognitive indicators are poor coping skills, performance anxiety, irritability, hypersensitivity to criticism, difficulty concentrating, and a generalized negative outlook. We also mentioned persons with GAD often have somatic complaint. Up to 94% report painful physical symptoms, although frequently without a physiological basis. So this is where we have to rule out again the UA. The lab work is very important when making a proper diagnosis. Also, I'm going to enforce the use of positive coping skills. Home care options may vary. That may help decrease anxiety include reducing caffeine and sugar intake, increasing physical activity to alleviate stress. It's recommended to work out about 3 to 5 times a week to help reduce stress anxiety, and also help to boost self-esteem. Cognitive behavioral therapy, mindfulness-based therapy, support groups, relaxation techniques, deep breathing, visualization, stretching, and physical activity to relax muscles are also very important in managing GAD and to increase the sense of self-control. For treatment and assessment, please contact NSD Mental Health Service for treatment. We look forward to seeing you. Additional resources can be obtained on Anxiety Disorder of America booklet. Thank you, and I look forward to seeing you the next time.